Hello, in this video we'll be discussing the dental treatment considerations and patient education strategies for individuals with anorexia nervosa. As dental hygienists, we're in a unique position to identify oral signs of disordered eating and offer compassionate care that supports both oral and overall health. So what is anorexia nervosa? Anorexia nervosa is an eating disorder in which individuals have an intense fear of gaining weight and a disordered body image, leading them to take extreme measures to prevent weight gain. This includes calorie restriction, excessive exercise, and taking diuretics and laxatives. It has the highest mortality rate of any psychiatric condition and can cause severe systemic and oral health complications. While patients may be reluctant to share their diagnosis, we can often recognize warning signs during dental visits, making our role in early detection and supportive care crucial. Now we'll talk about some oral manifestations. The oral cavity is often one of the first places to show visible effects of anorexia. These include paramolysis, which is enamel erosion on the lingual surfaces of maxillary teeth from chronic vomiting, xerostomia, or dry mouth, due to dehydration and antidepressants, which are often taken by anorexic patients, tooth sensitivity from exposed dentin, enlarged parotid glands from repeated vomiting, angular cheilitis, burning tongue, and delayed healing due to nutritional deficiencies, particularly in iron, B-complex vitamins, and zinc. And finally, an increased risk for dental caries, plaque accumulation, and gingival inflammation.
When treating a patient with anorexia, it is essential to adjust both our clinical approach and our communication style. Begin with a thorough medical and dental history and look for signs of vomiting, restrictive eating behaviors, excessive exercise, and use of laxatives or diuretics. Avoid abrasive prophy paste or aggressive scaling on areas of enamel erosion. Use gentle instrumentation and consider desensitizing agents or a fluoride varnish during treatment. Do not advise brushing immediately after vomiting, as the enamel is softened by acid and more prone to abrasion. Instead, recommend rinsing with water, a sodium bicarbonate solution, or a neutral fluoride mouth rinse. Suggest prescription strength fluoride toothpaste for home use, especially if caries risk is high. If a patient has dry mouth, suggest a saliva substitute, sugar-free gum with xylitol, biotin products, and frequent sips of water. Watch for delayed wound healing and adjust treatment plans accordingly, especially for patients with anemia or low protein intake. For patient education, it should be gentle, informative, and free of judgment. Our goal is to empower the patient, not to shame them. Key points to cover with them are the connection between poor nutrition and oral tissue health, how vomiting and acidic foods erode enamel over time, the importance of fluoride and remineralization products, daily plaque control techniques, including soft toothbrushes, non-abrasive toothpaste, and antimicrobial rinses, managing dry mouth with lifestyle changes, over-the-counter oral moisturizers such as biotin, or even prescription saliva substitutes like Saligen, and finally, encouraging regular dental visits for prevention and monitoring. These patients may feel anxiety or shame during dental visits. We can make a big difference by avoiding comments about weight or appearance, allowing extra time during appointments and offering breaks if needed, being patient and consistent, especially if treatment progress is slow, and establishing trust and showing empathy can help patients feel safe returning for regular care. Anorexia nervosa affects every system in the body, including the oral cavity. As dental hygienists, we must approach these patients with clinical skill, empathy, and a trauma-informed mindset. By adjusting our treatment, educating without judgment, and being a steady part of their healthcare team, we can contribute to their recovery and quality of life. Thank you for watching.